to create a joint replacement program or an orthopedic program. Why is this? Let's talk about a joint replacement program. Joint replacement is one of the most common surgical procedures that is performed among the elder population. The most common of all joint replacements are performed on hips and knees. Treatments of the disease of the knee or the hip joint does not end with the surgical replacement. The ultimate goal is ensuring the patient is pain-free functions and to improve the quality of life of the patient. Most of the time, post-operatively, the patients are going to be ending up in a rehabilitation facility or a skilled nursing facility or a nursing home. But what we need to do is this, is that when a patient is able to then go home, if we can actually put ourselves out there that we can be a leg or a hand to the skilled nursing facilities, and that you actually have a joint replacement or an orthopedic program that you can help these patients when they go home, when they run out of their therapy days or therapy payments, when they're in the nursing home or the skilled nursing facilities, right? So when they have to go home, you can be that leg, right? You can be that hip, you can be that extension of the skilled nursing facility. So you want to be able to detail and inform them about the services, about your step-by-step process on what your staff can do. If you can actually show them some data on how you have helped improve patients, you can do that as well. So you want to be able to explain to them what are the goals of your company, what are the goals of your agency to be able to help these patients who have problems or who had an orthopedic replacement or had a joint replacement or go out there and help them and help people know about your program. Look, you need to be able to help and make sure that they are able to return early. And you want to make sure that you help the facilities decrease the chance that the patient is having to go back to the hospital, or maybe decrease the length of stay at the hospital and guide them to get into the skilled nursing facility. And from then on, the skilled nursing facility can help them guide the patient to your agency. So you want to be able to explain to them what are the goals of your company, what are the goals of your agencies to be able to help these patients who had an orthopedic replacement, who had some joint replacement out there. So some of the goals that you may have is to be able to assist the patient to mentally and physically expedite the process of early return to the home environment. You want to be able to make sure that you want to help the facilities decrease the chance of the patient having to go back to the hospital, or maybe decrease the length of stay at the hospital and guide them to be able to get into the skilled nursing facility, and from then on, from the skilled nursing facility can help guide the patient to your agency. You want to be able to show them that your goals are of significantly decreasing any post-surgical complications. You want to be able to show them your goals to return the patient back to the normal activities at their home in the quickest possible time. Common conditions that are there for joint replacement therapists or orthopedic programs is recent total hip knee replacements, post-open reduction and internal fixations, close reduction of fractures. You have rheumatoid conditions, recent total hip replacements. You have your recent, joint replacements, joint sprains or joint strains, or even osteoarthritis. You want to be able to show what your program can do for these particular conditions. You want to be able to talk about how your skilled nursing can help by providing medications, or you creating a fall risk assessment program. Maybe you can bring in your fall program included with this particular joint replacement or orthopedic program. You want to be able to talk about your physical assessments, your post-surgical care. You want to be able to talk about your comprehensive medical and surgical history review. Then you can bring in your therapy services. What can the therapists do? From their physical therapists that can help with the neurological testings to home safety evaluations, through the equipment evaluations and proper use, to be able to provide assessments with strengths and reassessments, sensory assessment. At the same time, your therapist can be there for patient and caregiver education, strengthening and conditioning. Your occupational therapy can be there, right, to provide ADLs with retraining and home management education. There's a variety of different things that you can put in these particular educational based pamphlets or flyers to show the physicians, to show the discharge planners, to show the social workers what your company can do and what makes your company stand out among the rest. You want to be able to make sure that you create these programs. I cannot stress this enough, that you need to create programs out there and detail how this program can help not just the patient, but can help the agencies that's going to be able to be referring them to you. Remember, these programs' main goal is to reduce any readmissions of the patients. That is ultimately why these programs are created. It's naturally our job to prevent the patients to go back to the hospital. It is our job to keep the patients at the comfort of our home. But unfortunately, a lot of agencies need to stress these programs out, because these programs are meant to attack the average, the normal reasons, the top 5 to 10 reasons why patients go back to the hospital. So by us being the solution, we want to be able to provide the services, and that's what we're here for. Make sure you talk about how amazing your joint replacement program is, how amazing your orthopedic program is. By you doing this, by you selling this, by you then promoting this, you're going to get more referrals than the average agencies that don't have or even talk about their ortho program or their fall program. So these are things that, look, I can guarantee you, start looking around right now, not all agencies are promoting this. So also understand, look, how can agencies promote this, if they don't have this in their flyer? Or, I'm sorry, but, we did a quick study where we called over 5,000 home health agencies in the United States. And we found out that out of those 5,000 home health agencies that we've called, only 32% of them actually had a website. Only 32%. And when we started assessing, those websites, we started seeing that their websites were not even good websites. They did not take advantage of everything that's in it, so they don't even have their programs listed in their websites. So imagine that, they're not promoting it. If you go out there and promote it and say you have it when another agency is not even talking about it, you're going to be able to be standing out. So if a physician asks the other agency, do you offer an ortho program? Well, yeah, we offer an ortho program. And if that doctor asks the agency, well, tell me more about it, they're going to be mumbling their words because they never expected that. Whereas you, on the other hand, you already know to market it. You already have all these pamphlets. You're pushing it out there to the physicians. They already see the value that you have. And if they want to check with the current agency they're working with and say, do you have an ortho program? And they can't even answer it correctly, guess who's going to get the ortho patient? You! So this is what you need to be able to do. Be knowledgeable, know your products, know your services, and push it out there, and let the staff in the office also know how to answer them correctly. Everyone in your team needs to be able to answer these correctly, even your CNAs, even your home health aides, especially your nurses, and especially your therapists. So if you have any more questions, give us a call. We want to be able to hear from you. Have a great day.